10 News has been given an exclusive look inside a Royal Perth Hospital emergency training program. From the rescue chopper to the emergency room, the state's best nurses are learning life-saving skills to take frontline care to the next level.
Before a patient even reaches an emergency room, the race to save them has already begun. At Royal Perth Hospital, nurses are training for the moments no one can predict.
Really been focusing this year specifically on the patient's journey when they do have a trauma and where they might go and how they might get here and what kind of injuries they might have.
Those taking part in the postgraduate trauma program, the best in their fields from all around the state.
We're giving them that next level of information, so they go right into the pathophysiology of potential injuries, the assessment techniques, and we line it up with their objectives that they get with their universities for their postgraduate degree.
On average, the rescue chopper lands once a day at Royal Perth Hospital. For nurses training in the emergency field, it's a critical part of their training, learning what to do from the moment the chopper lands to transferring a patient to the emergency department.
So the trajectory of that patient from the moment they've injured themselves and the time frame, the treatment is very important for the continued pathway of their care once they hit the hospital. So it adds a lot of value for them to understand just what's happened prior to the patient arriving.
We only see what happens in the ED, and then we get handover from the paramedics or RFDS, but a lot more goes on behind the scenes, so it's been such an eye-opener.
Nurses taking part in the program will take lessons learned from the day back to their hospitals so that if and when a trauma arrives, they are ready. Megan Birch, 10 News.